All right. Good morning. Hello, everybody. Welcome. I'm so glad that you could make it. Today is our fourth Town Hall Zoom presentation. I'm Emily Farber. I'm the Director of Social Services at Avenidas Rose Kleiner Center. We are the Adult Day Health Center in Mountain View. And also we have a team of our staff from Avenidas on the call today. We have Amy Andonian, our President and CEO. We have John Sink, our VP of Operations. And also joining us is Paula Wolfson. She's the manager of Avenidas Care Partners and the brains behind this whole program series this month. So thank you for joining us. Through this challenging time, Avenidas wants you to know that we are here for you to make sure that you have all of your needs met. Please take some time after this or any time to review our Avenidas website, www.avenidas.org. Many of our recreation classes are now available online, and we have a wide variety of supports with grocery deliveries, social work consults, and many resources available to you. Please note that this webinar is going to be recorded and it will be available on our website within the next day or so. Our first 3 town hall presentations are already up on our website, so if you missed them, you'll have an opportunity to look at them that way. We are so pleased today to have Santa Clara County Supervisor Joe Simitian starting us off today. Joe was re-elected to the Santa Clara County Board of Supervisors in 2016, and he represents the 5th district, which I know many of you live in. That includes Cupertino, Los Altos Hills, Mountain View, Palo Alto, Saratoga, Stanford, and some portions of Sunnyvale and San Jose. Joe Simitian's public service over the years has included the California State Senate, the State Assembly. He was mayor of Palo Alto, as well as he held an earlier term on the Santa Clara County Board of Supervisors. He has long been committed to ensuring our community services are vast for our older adults and our families. And actually his work helped bring about the RIDE program, which provides rides to older adults in the West Valley of Santa Clara County, and he helps support Avenidas with our nurse navigator service at the Rose Kleiner Center. He is always looking for more effective tools to combat financial abuse and support seniors in a wide variety of ways. So we are really glad that he could be here today to start off the program. The only housekeeping note I have is that all of the participants are going to stay on mute at this time, just for the sake of being able to hear the speaker. So Joe, I will find you in a moment and unmute you here.
Good morning. This is County Supervisor Joe Simitian. I hope I'm coming through loud and clear. Yes?
Yes, you are on.
Thanks so much. Sorry we couldn't make video happen today, but it's good to see you all virtually, if not in fact. I wanted to just take a couple of minutes both to thank you all and thank Avenidas for the work you're doing as we work our way through what is undeniably a very challenging and unprecedented time. I think the message has come through loud and clear, but it can't be said often enough. The compliance with the stay in place, the shelter at home order from the county's public health officer really has been exceptional. And I know I get a lot of comments from people who see the occasional person flouting the rules, but for the most part, folks have really gone above and beyond to make sure they're in compliance, and it is having the desired effect. There was a lot of information pushed out during the first couple of weeks of the stay-in-place order, and I worried sometimes that there was too much information. For me, the bottom line messages were we need to flatten the curve, meaning slow both the rate of growth for the virus as well as reduce the overall number at the same time that we are surging our hospital capacity, so that at some point we could say we've had enough time, we've made the time by flattening the curve to allow our healthcare system to ramp up in terms of the number of beds, the number of ventilators, the number of intensive care units, the number of staff, frankly, who are available. And I think we can say that we've had a very good result in that regard. And that is, frankly, a function of the fact that the public has been so good about stepping up in a difficult time. So thank you to you all. I want to be able to tell you from the county's perspective, where we have 3 hospitals as well as a wide-ranging system of clinics out in the community, that things are going well. There are challenges, there are problems, there are obstacles, but people are meeting and mastering them every day. So thank you to them, but more importantly, I wanted to be able to offer some words of assurance. And then the next thing I wanted to say was, because I know this is going to be the topic of the conversation to follow, and I want to make sure that our experts have time to share their expertise, is that I am, of course, acutely mindful of the particular concern around nursing homes. They represent a particular challenge, not just here in our county, but around the country. And that is in part because we've got a congregate setting, a lot of folks in close quarters, plus it's a group of folks who are particularly vulnerable. And that makes nursing home settings a particular challenge. Right now, the most important thing that we can do is make sure that no one walks into one of those nursing homes bringing the virus in. That means that for the 50 to 60 nursing homes in Santa Clara County, there needs to be a regimen where every single member of the staff is tested on not just a one-time only basis, but on a recurring basis. That process is underway. We talked about that quite specifically at my request just yesterday at our regularly scheduled Board of Supervisors meeting. So please know that our public health officials are in touch with all 50 to 60 of these nursing homes in Santa Clara County, and that the efforts to make sure that there's a good testing regimen in place are underway, so that, as I say, people don't walk into one of these nursing home settings bringing the virus in, and that really does require rigorous testing of the staff. Last thing I'll say is just this is an unusual circumstance in that in order to be successful in this effort, it depends on public acceptance and compliance, frankly, with the public health officials' directives. And so this isn't one of those things where government can just go off and do it. This is one of those times when we really need the engagement of every single member of the public. My own view is that that will only happen if people feel like they have the information to understand and accept the validity of the direction that they're being given. And so I've done telephone town halls in order to try and provide that information, give people direct access. Some of you participated, I expect, in the one that we did a couple of weeks ago. We're going to do another one this coming Sunday from 11 to 12:30. It is the second of 3 that are planned. We may do more. If you'd like to join that telephone town hall, just go online to my website. Just Google Supervisors Simitian, and you'll find your way there quickly. And sign up for the telephone town hall this Sunday from 11 to 12:30. We will have both our county executive, excuse me, Dr. Jeff Smith, who happens to be a medical doctor as well, and who's sort of in the center of the activity, as you could imagine. Also someone from our legal counsel's office, someone who can help us sort of work through what the rules and regulations are and where they came from and who gets to call the shots. And then finally, the head of our hospitals who can talk authoritatively about what we're seeing in all 3 of our county hospitals and out in the clinics, and provide some assurance that we're well equipped to deal with whatever demand there may be. So again, if you'd like to participate, just encourage you to go to the website, Supervisors Simitian, and find your way there. That's really all I have at this point. If you have individual questions or concerns, please reach out to my office either by phone or by email. We're easy to find. Again, it's the benefit of having a name like Simitian. There aren't that many when you turn to Google. The office number is 408-299-5050, 408-299-5050. We are following the directive of the public health officer, so we're down to a bare bones staff with the rest of the team working from home, but we'll get back to you as soon as we possibly can. Be well, and again, thank you, and let's take advantage of the expertise that I know is on the line. And thanks again.
Thank you so much for joining us. If you were just coming on late, that was Joe Simitian on the Santa Clara County Board of Supervisors. We really appreciate your input and all the work that your team is doing during this time. So right now, I want to turn it over to our speakers. And today we're lucky enough to have the expertise of two highly regarded medical professionals and leaders in geriatric care. Dr. Mehrdad Ayati is an adjunct assistant professor of medicine at the Stanford University School of Medicine, where he teaches geriatrics. Dr. Ayati is board certified in both family and geriatric medicine. He's also the director of the Geriatric Center in Los Altos, which is a unique second opinion clinic for elders and family caregivers who are concerned about their medication regimen, stress, mobility, cognitive and physical health. Dr. Ayati has actually joined us throughout the month to keep us up to date with the latest information. And also joining us today is Dr. Marina Martin. Dr. Martin joined the geriatric medicine faculty at Stanford in 2012 as a primary care physician in, at that time, the newly formed Stanford Senior Care Clinic. In 2014, Dr. Martin became the medical director of the clinic, and in 2015, she became the first section chief of Stanford's new section of geriatric medicine in the School of Medicine. In this role, she oversees clinical, educational, and health services research programs that promote compassionate and personalized care of older adults. Dr. Martin's clinical practice also consists of post-acute rehabilitation and long-term care at the Webster House Health Center, a nursing home in Palo Alto. Please note that we're going to leave ample time for questions towards the end of the program, and all participants will remain muted, but if you have any questions, please use the chat feature as part of Zoom. So Dr. Ayati will be starting us off today, and I welcome both Dr. Ayati and Dr. Martin. Thank you so much. I'll get you unmuted right here. Okay, you should.
Thank you so much. I appreciate it. Good morning, everyone. It's a pleasure to be here and also with my wonderful colleague and Dr. Martin. She and I have been working for many years at Stanford, and it's a privilege to be with her today to discuss about the challenges of nursing homes and assisted living facilities and home care. So I wanted to screen shares of my presentation here, and I'm just we have some slides that we're going to share. See it? Okay. Perfect. Let's just talk about COVID-19 challenges in the nursing home and assisted living facilities. It's a very challenging topics right now these days, and I wanted to be briefly on the slides, and then we give time for discussion more. And again, the slides are more some of the news, some of the topics about what we are discussing today. The first thing is I think everybody's agree with that the people who are living in long-term facilities and staff, they're at a high risk of the COVID-19 infections, and we will talk about it a little bit, and Dr. Martin also can point it a little bit. I mean, but we know because of the vulnerability of the people in the skilled nursing home, we talk in the initial of the pandemic, the people have risk of the diabetes, high blood pressure, heart disease, cancer, stroke. They're the high risk of mortality in COVID-19. That was the public news, but you can find all of them in a skilled nursing home. Everybody in a skilled nursing home at least take one blood pressure medication. Most of them, they're taking diabetic medication. Most of them, they have a stroke, they have dementia. And the staff also, they're exposed to these people. And that's why this is not the story of COVID-19. Every year when we have influenza, always the outbreaks happen in skilled nursing home. They're the very, very high risk for having all this infection. If we have a massive outbreak in any of the long-term facility, that was one of our concern, and it still is our concern. Even now we are in the flattening of the curve. We all waiting for, I mean, we hope it's not happened, but everybody worry about the second wave of actually COVID-19 outbreak. And if that happens in our skilled nursing home in the largest scale, is our healthcare system really able to accept all of these patients from skilled nursing home in a local hospital? If one or two of our skilled nursing home with 50 or 60 beds, they all have a people with a severe respiratory problem, and they're all going to transfer to a local hospital, or local hospital is going to be completely full just by skilled nursing home patients. And the other concern that we have, it's that many of these people in assisted living facility, memory care, and also skilled nursing home right now, because of banning visitors, which is a very right decision to make. But we also knowing about elderly social isolation, depression, high risk of abuse and neglect happening actually in a skilled nursing home. And then something we can a little bit discuss about it, that is this something that we could avoid that at the beginning? If we had enough resources, we are able to have the skilled nursing home still be open for the visitors, that at least they can see the loved one. Now, if you agree with all these items, I don't think you need to sit for the rest of this discussion today. You can actually go. But if you're not agree with any of them, we have discussion. You can be with me and Dr. Martin, and we can discuss about these items with you. Now, where are we right now? I'm sure that you hear in the news, currently there is a 2,300 long-term facility in 34 states. They reporting they have COVID-19 positive cases. But very interesting that at the beginning, in the weeks ago in Spain, probably you hear in month of March, that the police found a skilled nursing home in Madrid in Spain, that many bodies left in a skilled nursing home, and they found it after 2 to 3 days. There were no staff showed up actually in a skilled nursing home. And the police went and entered to a skilled nursing home, and they found 30 and 40 bodies in their beds. They're all left. They're all abandoned there. And then when we look at the data from Europe that actually the Guardian just published over the weekend, that a snapshot that we have from Italy, Spain, France, Ireland, Belgium, around 40 to 50% of mortality that is happening to Europe is actually in the home cares, boarding care, skilled nursing home, long-term facility. And this is based on the reports coming from London School of Economics. And that's kind of like very scary. And probably last week you hear that the same story that happened in Madrid, that happened in New Jersey. Just another skilled nursing home with many mortality actually happened. And that's kind of like, again, the scary things that we hear till this week. There was Care England. This is one of the largest UK representative body for the care homes. Just published a news in Daily Telegraph that up to 7,500 care home residents may have died of this virus in UK. And this is more than the figure and that actually estimated to be died by government earlier this week. Now means estimation of the people actually they pass away in the UK is much higher than that. And this is from last Saturday. And that's kind of like telling us that how critical it is, the subject that we're talking today. And the article also published in Mercury News last weekend, both quoted me and Dr. Marina Martin there, is just about what happened exactly to nursing home. This is exactly what we're discussing today. But currently what we know that COVID-19, it's providing us a very valuable, but at the same time, very painful lesson. A lot of things, especially for vulnerability of the individuals. We have the skilled nursing home with the chronic condition. We learn about the preparedness. We learn about coordination. We learn about monitoring. We currently have like above 2 million sick people and elderly people right now in long-term facility. Something more than 1 million staff actually working in this skilled nursing home, 1.3 million people working in many places, including board and care. And this is kind of like what we are worried about. If we're going to have a massive outbreak in a skilled nursing home, what exactly going to happen in the future? Now, you probably hear that this weekend, for the first time, California start to releasing all the positive, cases in a skilled nursing home, and also in entire California state. And it's about 258 facilities has been reported on April 17. Total staff has been infected is 1,290 and total patient 1,740. And this is the first report that we have after weeks we're waiting. Most of them happened in Southern California. We actually did better. Dr. Martin is going to talk a little bit more about it. And but why exactly this happened? This is going to be the subject that we're going to talk about it. Number one is that we talk about high-risk population, that there are a lot of the risk to be vulnerable for infection. Definitely lack of the PPEs, which something that Dr. Martin and we can talk about it. Lack of education and guidance, that was something that absolutely we have noticed. The beginning of the pandemic started from December. We had couple months, and then March, suddenly everything becomes chaotic in California. We had a lot of golden times in order to prepare our skilled nursing home for tons of education and preparedness for that time. That what happened if you have COVID-19 patient? What are you going to do with the staff? We kind of lost this golden time for like 60 days, and suddenly in March everything became chaotic. All the people are just starting to go to stores and buying the stuff. Everybody's staying home. Schools getting closed. And I believe, and this is my personal, I think everybody in this field, we kind of abandoned this assisted living facility, skilled nursing home, all the attention's more an emergency room. And one of the other things that traditional design and infrastructures of nursing home, it used to be, we call it nursing home for rehabilitation or people come, but right now nursing home, because of the growing aging population and also the more sickness, is kind of run like a medical surgical units these days. But honestly, they haven't been designed with the same infrastructure and resources that the hospital is supposed to have. They're still traditionally nursing home, but they have more sick people, and they actually require more skilled people and expert people to involve with these people. But that hasn't happened yet. I mean, we have more improvement here in the skilled nursing home industry, but we're not at the standard for based on the population. Now I'm going to turn to Dr. Martin to discuss about, again, what exactly going on, and I will be beginning with some more slides. And I'm going to turn to Marina right now, please.
Thank you. Thank you, Dr. Ayati. So a lot of you may be more familiar with the different kinds of residential care facilities than many health professionals and public health professionals are. But just as a review, I'd like to go over the different types a little bit, because the way coronavirus shows up and is responded to is actually significantly different, because these facilities are different. So the first group that we talk about the most is nursing homes, which are more technically called skilled nursing facilities. And these really are medical facilities. The State Department of Public Health oversees them and does regular surveys and credentialing for them. They have a physician medical director, a director of nursing. They usually offer rehabilitation on site, physical therapy, speech therapy, occupational therapy. They have physicians who admit the patients and are on call for care of these residents. So these facilities, in many ways are much more clinical and able to manage something like an infectious outbreak. And on the other hand, also are exceptionally high risk because they may have the most frail and vulnerable patients, in particular people who are long-term care residents of these facilities. The reason they live there is because they need a great deal of assistance and their medical conditions are quite advanced. So this is a very, very vulnerable group. And for those who go temporarily to a skilled nursing facility for rehabilitation, they may or may not be as medically vulnerable. Many really are, as Dr. Ayati said. They come out of the hospital very quickly and are still quite ill and need a lot of help when they arrive from the hospital. But just the fact that patients are coming and going from the hospital to these nursing homes obviously makes a very easy portal of entry for coronavirus or other infections. Assisted livings, on the other hand, and I'm going to include in that memory care units and board and care. And these are part of a larger class of communities called residential care facilities for the elderly, or RCFEs. These are really non-clinical sites. They may or may not be part of a larger community, like in our area, the V or Sequoia's Portola Valley or Channing House. We have multiple communities locally that do have assisted living and skilled nursing on the same campus, but many are standalone or affiliated with an independent living community that might be on the same campus as well. So assisted living is really not medical. This is residential care, and under the state government, it's actually under a completely different branch from skilled nursing facilities. It's under the Department of Social Services. And they don't have, typically, they might, especially some of the better ones, have a medical director or somebody, a physician helping on site. But especially many of the smaller ones do not have the benefit of that kind of support. And basically, as Dr. Ayati was saying, both the skilled nursing facility and assisted living settings are a perfect setup for transmission of coronavirus and influenza viruses when those outbreaks happen. And it is the combination of the most vulnerable patients who are most likely to get ill, the congregate living, the need for very personal attention and assistance. So needing to get up close and personal to help with things like bathing, brushing teeth, feeding sometimes, so it's not possible to socially distance in these settings. The fact that there's typically one nurse to 20 to 30 residents in these facilities, so one nurse who might be asymptomatically infected goes from patient to patient to patient to patient, and that really provides an easy way to spread the virus. And also many of the residents might have cognitive impairments such that they may not be able to properly wear a mask or understand social distancing or why they should be separated from others for the time being. There's also been a lack of personal protective equipment in these communities, both the kind that helps prevent introduction in the first place of the virus, so that would include surgical masks, even cloth masks, and the kind that you're supposed to wear once there is an outbreak, which is the full N95 mask, face shield, gowns, etc. So that makes it very hard to contain the virus. And then there is inadequate education as well and training. Most of the staff, the dominant worker, I would say, in these facilities is a certified nursing assistant. Depending on some of the places I've been, they may have limited English proficiency or not have finished high school and have an 8-hour certificate in being a medical assistant. So they have no clinical training or infection prevention training really, or expertise, and it wasn't part of their usual, what they grew up with necessarily even, kind of the common sense things that we're trying to get people to do right now. And so there's a lot of education and support needed. My experience recently is that many of these people are saintly and working for minimum wage, oftentimes at more than one facility because it's so hard to live here on a minimum wage job. And then that, of course, helps them transmit between facilities too. that these staff are really amazing and they're working really, really hard and trying to support their communities. But as we've heard, in some places, they either get sick themselves and then are not allowed to come into work, or get so terrified of getting sick under the conditions of having limited masks, et cetera, that they don't go to work anymore. So staffing shortages have been a big, big issue. Do I change the slide myself, or?
I'm going to do it, yeah.
Okay, thank you. So based on the national kind of, I would say everybody in CMS, which is the organization that directs Medicare and Medicaid, and the CDC, and the departments of public health, and departments of geriatric medicine in academic centers nationally, and professional organizations who work with long-term care facilities, we do have a sense of what would help in these facilities, and it's not all that different from hospitals in many ways. And the 4 keys really are optimal infection prevention, and that's all about good hand washing, mask wearing, and social distancing. Those are really critical. And so helping facilities to get masks and to really know how to hand wash properly and when is a really important part of preparation and response in facilities. So really you want to keep this out if you can. Then helping places to have sufficient levels of personal protective equipment, and this would be the real N95 masks, the face shields, the gowns, the things that are critical once coronavirus has entered the facility, and training on how to put them on and take them off properly and use them properly. So that's another major area. Also readily available testing. So the best practice now really is, if coronavirus enters a facility, is to test everybody, all the staff and all the residents of that facility. Unfortunately, that can lead to it's a bit of a catch-22, or lead to a crisis in staffing, as many times a lot of the staff will come back positive and end up needing to be out. And many of them may have been asymptomatic, and most likely, the thought is, with all the experts I've been hearing from nationally, is the most common reason that the virus is getting introduced into facilities is through asymptomatic staff. So it's problematic in some ways to test all the staff and have many not be able to come, but it is required and necessary to prevent them spreading it to the people that don't have it yet. And so that's a really important intervention. And then I think, as Joe Simitian was saying, being able to test asymptomatic in facilities where we do not believe coronavirus has appeared, to be able to regularly test the staff so that we don't have them introduce it in, will be increasingly important. But to do that, we need to have really good access to tests and testing arrangements and strategies and supplies and all of that around that. And then finally, those staffing plans, when a facility does get infected, there needs to be backup. And unfortunately, I would say all 4 areas of these are severely lacking around the whole country. There are the entities responsible for helping facilities to prepare and respond to coronavirus include the county and state departments of public health, and the emergency operations centers in each county, which are closely affiliated with the departments of public health, but include other people, including the emergency medical services, first responders, crisis planners, et cetera. And so really all the efforts that go into helping facilities prepare and respond need to be coordinated through those centers, and they are certainly trying really hard, but it's a sudden huge demand that they weren't really ready for, I would say. And so they are trying to figure out how to do this better, and I think it will continue to evolve a great deal over the coming days and weeks. I truly don't think it's for lack of caring. I think in large part it was from lack of preparation, and this has been very eye-opening for me as well, because I've never been involved in this kind of preparation or response. So it's been a very steep learning curve for all of us, but I'm hoping that the experience we're going through right now in understanding how to help and support these facilities will translate into much better preparation in the future and better understanding of these facilities and where they fit in the healthcare system and how to support them going forward. I just got off a webinar for a national webinar on this topic, and it brought a lot of leaders from the state of Maryland. And interestingly, they had a lot of things in place already, not because they had gone through an epidemic or a pandemic before, but because they have had so many hurricanes. And so there's a certain amount of lack of preparation that we have in this state. I think that's because we've not had to deal with anything like this before, something that really takes out our whole state at once, and all of our threatens all of our facilities at once. So I'm hoping there's a lot we'll learn from this. Thank you for inviting me.
Thank you. Now, I'm just gonna go and discuss again for continue our conversation that what is exactly the problem is going on right now, and that's something that we discuss about it, and Dr. Martin also discussed about it, that is staffing issue. You know, as we discuss that we use the word of the nursing home, which is nursing in the title of this institute is there, but and also the regulation. But honestly, this is kind of like unrealistic expectation from the level of care, because when we talk about nursing means that we should have more registered nurse in a skilled nursing home facility. And but this is not something we actually in reality we see in a skilled nursing home. Majority of a skilled nursing home in the country, we're not talking about our area. The reason is when we talk about a registered nurse, they are more prepared, they have better knowledge, they have better skills in order to dealing with the crisis situation. And again, majority of the backbones of the skilled nursing home are LVN and also CNA, as Dr. Martin mentioned, which they are doing a very, very hard work on that. But again, it's just the reality is that we need a little bit higher level of the staff as far as expertise and skills in a skilled nursing home, in order to not dealing with only the pandemic and outbreak. This is the first pandemic for since Spanish influenza in our history, but we're talking about overall caring for these vulnerable people. Some of them, they have dementia, some of them, they stroke, some of them, they are tube feeding, some of them, they have wound and many other stuff. And then definitely that requires more to have more expert people, which is especially on the nursing level, to really caring of these people. Now, we have lots of data. One of the things that this is the gang article in 2019, and there's also the Kaiser report data. It's showing that half of the facilities, there are only technically is, as far as expected, the staffing ratio, what is recommended by CMS, there's not going to be met the criteria in 2019. Staffing issue is definitely for RN. 91% of facilities that met the guidelines of the CMS less than 60% of the time, which is not only for just during the day, but even like a shift. Because as Dr. Martin mentioned, most of the time there's going to be 20 patients, 18 patients per one nurse. And again, because one of the other things that we see today, which we never seen before, I can tell you as a geriatrician, every year I see more complex patients in a skilled nursing home and more chronic diseases, more demented patients, a stroke, many other things. And is that definitely one RN is they have to spend a lot of time with each one's individual patient. And it's not easy to only do med passing and go from one room to other room. It's not as like that before. And that's why it requires to really provide more staffing. And this is something we can easily see in most of the reports that we have so far. There are definitely the infectious disease, even like we have the very nice article in Journal of American Geriatric Society just published in April 3rd. The outbreak it's very dangerous in long-term care, even in the ordinary times. It's not only about a pandemic time. Even the time when we have influenza, even like 2017, as many of you remember, we actually lost many people due to influenza in 2017. Even in our area, Bay Area, we lost many patients at Stanford as well. We even lost many kids in Lucy Packard Hospital. I mean, but technically, a skilled nursing home are the place for any outbreak of infectious disease. Even we're going to be very soon going to have intestinal infection, norovirus infection. The long-term patients can easily die of dehydration, and they're just going to be transferred to emergency room. Any kind of outbreaks is just going to be the question. Now, whenever there's an outbreak in healthcare, the skilled nursing home, the number one is that our healthcare system will be a tremendous pressure to transfer the sick people from a skilled nursing home to the ER. Something that we have to understand that the skilled nursing home, they're not designed, or they are being equipped to really taking care of the very massive outbreak, especially in the pandemic situation. We have to understand it's not like a hospital that they have enough space to really make the facility for isolated patient, like we make an isolation unit. It's not as easy in a skilled nursing home. Most of our skilled nursing home or nationally in our country, they have like 3 or 4 patients in one room. And then if they wanted to make the isolation unit, it's going to be very hard to move this patient. Not all this patient can stay in the same room, even like a healthier patient, because one of them has dementia. It's very delirious. The other one has, they need a Hoyer lift at the same time. Lots of noise is going to happen. The other patient's going to be delirious. It's very, very hard to have this. This is why we talk about the design and infrastructure of a skilled nursing home. I'm not saying in our country, globally, we're talking about something that we learned from this pandemic that hasn't been designed for this situation. And this is by design. This is not negligence, actually. And the other things is, as Dr. Martin mentioned, that assisted living facility and memory care, they're not medical unit, but in reality that they are taking care of many of the people, especially with dementia and memory loss. And they not only they have dementia, they have many other medical problems at the same time. And I think what we can learn from this lesson is that maybe we need to make some change in regulations in the future, even for assisted living facility, board and care, to really bring more expert on that, because managing these people, especially people with dementia, people they have chronic diseases as well, is not easy. It's really required the higher skills of level. They may need to have, again, the more professional people to come and help them. And as we talk about it, lack of PPEs, and when we talk about lack of PPEs, it's something that we need to understand that, again, we talk about how vulnerable of the staff and also the patients in the skilled nursing home. I think I have one criticism toward or public health department overall, that I know the attention was more around the hospitals, but we should do better. And again, this is not all about what we've done. This is about the future. And what we need to do is that we have to make sure that for long-term places, assisted living facilities, and these places, they have adequate PPEs for the time of crisis. That's something that we need to learn from this lesson this time. And in the next time, be able to handle it much better. I can tell you, and Dr. Martin and I, we can share with you that honestly, we're just trying to, physicians and many other people in the community, they're trying to get as much as PPEs we want through the donation and everything, and distribute through the team to a skilled nursing home, and especially in the first weeks of March, which was very, very critical. And that's something that we definitely affected us. Now, there's something that we talk about it is that visitor restriction is the worst choice, but we have no any other alternative. Who's responsible for that? We are responsible for that because we haven't provided enough PPEs for people in order to the person is able to go to a skilled nursing home and see their loved one. We can learn from, I know the Germany population is not equal to us, even South Korea, which we're talking about it. But what they've done, they did a massive testing, as Dr. Martin was mentioning about it. And then when they have one positive, they're able to isolate the people, they're able to provide PPEs for visitors, that they're able to come and see them. This is a very important topic. Many of or Bay Area skilled nursing home, I will say at least the area that we're living, Santa Clara, San Mateo, we have a really high quality skilled nursing home, but this is not the similar story everywhere in the country. We hear a lot of the elderly abuse. We hear a lot of the neglect in the facilities. And most of the time, this abuse or neglect is actually found by the family when they come and visit their loved one in the week, and they see, oh, for example, the diaper has been changed, there is a new there's a new bed sore, or the medication supposed to be given is not given. Right now, the families, they have no information available for their loved one right now. The state also is not providing enough supervising or go and monitoring the residents to make sure everything has been done very well. I mean, this is something that we can learn as well for this situation. My prediction is after the shelter in place is going to be removed, after all this restrictions going to be removed, we're actually going to have a number of the elderly people in a skilled nursing home with kind of like a more worsening of depression and PTSD after this pandemic. And we are, as a geriatrician, we're going to deal more in our clinics actually with post-pandemic, I will say, stress trauma. We probably need to use the new syndrome and term in the geriatric science about that, because they're gonna have more anxiety, fear of isolation. I can definitely say that, and this is why we need to pay attention more to that. Now, suggestion of the idea that probably can help this. It's very disappointing that the task force of the government at the beginning, Vice President Pence and also President Trump, I haven't heard for weeks one single word and sentence about priority of a skilled nursing home and long-term facility. I mean, you can look at all the news and on all the archives. I haven't heard that. This is very, very important that in the future, especially as everybody talking about second wave, the long-term care residents should be on the priority sites for COVID-19 testing and personal protective equipment. This is definitely, we need to do it. This is definitely, I encourage everyone, if you know any of your any person on your local area, this is the voice that we need to and awareness that we really to raise. And again, the other things that I think is so important for facilities, most of the CNAs and facilities staff, they don't have any paid sick leave for staff, and this is the issue. If they have symptoms, they still come to work, and we have the same experience in New York. I had many Zoom meetings with my colleague at New York that they are in a skilled nursing home. And this is the #1 complaint that they said. They said, my staff, they have fever, but still they have to come to work because there's no paid sick leave for that. And New York is a very expensive city. They have to pay rent, they have to pay for their family. Most of the staff, they're actually the single mom or single dad, and they cannot afford to go home. This is something we need to learn from this pandemic for the future, that actually we definitely have supporting system for the staff of a skilled nursing home. In case of the outbreaks, be able to pay them and be able to stay home. And then definitely bring helpers. We have to find a solution for that. If our local hospital are not overwhelmed, if we can get any help from the state, Army, or anywhere else, we need to definitely should have instructions that in case of a staff of a skilled nursing home or facilities, they are sick, that we have the helpers to come and help them as well. And this is something that we need to do. And then at the last, which is so important, we need to redouble actually inspection in long-term facilities for the future. They need to make sure that, first of all the facilities are adequately staffed. the residents' needs are being met, infectious control and procedures are being followed very well, especially in these days, as the families are not able to see the loved one. It's a job to state to provide more supervision to all facilities. And again, the same thing for assisted living facility. And my last slide is going to be the task force of the people that they've been really helping. My colleague, I've done nothing in this team. Of these people actually been amazing. Dr. Marina Martin, Dr. Yusra Hussain is our colleague at actually Geriatric. Dr. Kanchan is actually at the Stanford faculty as well. And our wonderful colleague at Palo Alto Medical Foundation as well, Dr. Peter Chang and Dr. Albert Lam and Dr. Amy Su. And also a special thanks to Pat Robinson, actually been amazingly helpful. Now, what happened is that we all, through the team, we try to talk to each other. We see what facilities they have a problem with the PPEs. And it's like each of us, I mean, my car always, I have some box of the mask and all this stuff, gloves, and just deliver to the facilities or give it to Pat Robinson. Pat Robinson actually made a wonderful job to distribute it to facilities, hospice care, home health, that they really need help for the PPEs. And I can tell you, when I talk about donation, I have a family member, like elderly people, that they had 2 N95 masks, one, I'm not talking about 2 boxes, and they brought it to me to give it to a skilled nursing home. And I have a family members that they have like 5 gloves at home, and they call me and say, we have 5 gloves when we wanted to give it to a skilled nursing home. And this is exactly what I've done. Go to their home, get these 5 gloves, and then distribute it to a skilled nursing home. And I think with really, I will say that really I'm very proud to be a geriatrician in this community with my wonderful colleague. This is a wonderful time for we all getting together to really help for community. And this is all my slide. Thank you so much for inviting us, and we're happy to answer any questions that you have.
I just wanted to do a little addition. Thanks for the prompt from Paula Wolfson at Avenidas about the rights you have to around discharge to skilled nursing facilities. So should somebody get admitted to the skilled nursing, or to the hospital, pardon me, and not wish to be discharged to a particular skilled nursing facility, that you are able, it is your right to refuse or to appeal that discharge if you think it's premature or unsafe. This is true regardless of coronavirus. This is a right that you have. So just to be aware of that, that at this time that might be more pertinent than ever for some of us. So. And I think there was another question here on from Scott Mueller. Testing is so critical. When can we expect to have wide-scale testing of at least the staff? And will it always be triggered by staff being positive? That seems too late, and completely agree on that being too late. And I think increasingly we'll see, hopefully over the next week or two, that testing spreads beyond just facilities where we know there are patients. The exact timing of it depends. Trying to work on the Stanford end with helping to support the public health departments in our 2 main counties of Santa Clara and San Mateo with processing their tests, and even hopefully we might even be helping to do the swabbing for folks to help them. But everything's taking a while to get in as we're learning about the virus and how to respond, and there are just so many facilities. I mean, if you count all of the ones in San Mateo County alone, there are 16 skilled nursing facilities. There are like 45 assisted livings that have at least 20 residents. But the total number is something like 430 places. So these are facilities, the majority of which are small board and care homes with up to 6 residents. But it's a lot of places, and that's just San Mateo County. There's also Santa Clara County, which is much larger. So it's a big ramp up to try and get there.
Hi, everybody. Can you hear me? I've been unmuted. So hi, I'm Paula Wolfson. I'm the manager of social work at Avenidas, and we started this a few weeks ago. And I just want to thank Dr. Ayati for dedicating his time and speaking with all these doctors each week. And I've been online listening to all of you. And I want to jump in on this conversation at this point because I'm running a crisis intervention line from my home, where I am right now in my bedroom. And I'm getting a lot of phone calls from the community about many of the things we're talking about each week. And most of you don't know this about me, but I started my career in 1980 at a nursing home in DC called the Washington Home for Incurables. Now I want you to think about that title for a second and the sensibility and the attitude we have about older adults who are frail, who are no longer paid working members of our society and are now in nursing homes. And I think we're not talking about this, and maybe it's a whole other subject, but I think there's a sense of ageism, who is of value in our society, that's gone into the design of these infrastructures and these various types of facilities for older adults. And I know Dr. Ayati and I kind of have talked about visions and big pictures of what would make more sense than what we have now for when people become ill. Smaller places, more monitoring, closely affiliated with medical schools. There's so many amazing people in our community, design thinkers and doctors, who I've been able to be in conversation with privately about what would be the ideal place. Where would we want to be as an older adult right now if we were sick and this was going on? What would be our vision for the right kind of care for us? And that's a whole separate topic, but I think that's where these conversations ultimately need to go. We don't have to keep things as it is. We just need to bring all the very smart people in our community together to have this dialogue. But for right now, we're in this situation together, and there may be a bit of a change right now. And next week, we're going to have Dr. Ayati coming back to talk about next steps, pre-COVID, the next wave, what we are going to do, how we're going to handle it. So some of the conversations about skilled care versus non-skilled care facilities, here's what most people don't understand. In the big nursing homes, you have medically licensed people providing hands-on care. Now that's supposed to include a social worker who, in the ideal world, when I started out, is an advocate for the patient. So if there's a problem, that's the person you would normally start with and then work up the chain of command with a grievance. But right now, if you have a grievance, you might want to call and see if you can get through, but there's a Medicare 1-800 hotline number for grievances about the quality of care. I don't know if anybody's actually trying to do that or if those people are still answering the phones, but that traditionally was the way to handle a grievance. HIPAA is an issue because, yes, we want to know where the virus is. We want to know which facilities have them. We want to know that about assisted care. So they're going to open up that conversation and be more transparent, but we're not going to know names of people, and we have to protect the rights of our patients and our staff, but we do need to know where the hot spots are. Assisted living, memory care, or custodial care. So there are no doctors, social workers, nurses there each day. Patients and families need to be able to bring their people in and talk to them. Some people have written in and suggested, why not have the staff in all of these places take their temperatures before they come to work, middle of the day, and when they leave? Because in the independent facilities right now, if you're living there, that's what you have to do. You have to have your if you leave, you have to have your temperature taken when you come back. So I think there's lots of things to talk about. So one of the questions we got was about Dr. Martin and Ayati, about temperature taking. Would that be a wise thing for staff to do in these places?
It is mandated by the Department of Public Health that all of these facilities should be checking temperatures at least once per shift. And a shift is typically 8 hours. It's not usually more than once in my experience. I don't know, Dr. Ayati, if you've seen differently. But at least once per shift, that there be a temperature taken at the start of the shift before the person can start working, as well as typically a questionnaire about symptoms. So that is absolutely critically part of the infection prevention at this time, although, as we do know, a large number of people remain asymptomatic, so it's not sufficient by any means. Yeah.
Yeah, I agree. Again, as we talked in the last weeks, the nightmare of this virus is really asymptomatic people. 35% of the virus shedding and contamination. It's really the people have no symptoms, and again, especially the younger population, and that's kind of like a very scary thing. There was a similar situation in Germany and South Korea as well, that they found many actually staff of places, and especially long-term places or home care, which they call it more internationally, they had no symptoms, but they became positive. And they going still to the facilities and taking care of the people. And this is why we talk initially, the best solution for these places are massive testing. The similar situation that they've done in Germany, which has been extremely successful. They massively test everyone, the staff and also the patients, and they isolate them. This is why they had a much better actually relief for that. But again, because we don't have testing, I think it's at least we can check the temperature, and we can at least doing the questionnaire to make sure. I know that from the last 2 weeks, no state ask that the people are not allowed to work in the different facilities right now, and then they have to answer this questionnaire as well, that do you work in other facility to come because of the cross-contamination between the facilities as well. But again, this may be practical for some weeks, but it's not in the long term, because the staff, they need to work. I mean, we cannot ask them to not working without any compensation. We completely understand. They're already very underpaid. And they have to work like a 2 to 3 shifts in the different facilities in order to make their life living. And this is why we talk about that. We definitely in the future needs to have a better strategy in order to have at least better payments for these people. Or in this situation, part of this stimulus package needs to really go toward the staff in the skilled nursing home and assisted living facilities in order to help them financially, to take care of their families without having the fear. And if they are feeling sick, they stay home and they be compensated, and there's going to be replacement to come and help them.
See some good questions on the chat as well about, is there a current list of every long-term care facility, including assisted living and independent living facilities where COVID-19 has been confirmed? There is a state California Department of Public Health list of skilled nursing facility names that Dr. Ayati showed a little bit of in his slides. And Santa Clara County is reporting the number of cases in long-term care facilities, but I have not seen a complete list of every long-term care facility, including the residential care facilities like assisted living and independent living. I have not seen that. And I think it is true that in many ways they do worry about their reputation and getting it out, but I think that will become less and less of an issue as this becomes basically most communities will unfortunately probably see a case, at least one. And so I'm hoping that transparency will be more forced. And if it's not, then it'll just become such that everybody's in the same boat, such that everybody shares their information.
Well, they did say, I think the newspapers yesterday, that everybody is going to have to be transparent, that not just nursing homes, but assisted and memory care, that they're going to have to start reporting publicly too. But just so people know that if a person is hospitalized and doesn't quite need the nursing home or the memory care, if somebody wants to take somebody home, that is still an option. And there are home care agencies, and some of the owners, I know them, are online listening. There are home care agencies that have equipment, that their people are highly trained, and that they're operating and they're out there. Also with end-of-life care, you can arrange for home hospice now. And also Mission Hospice has a home hospice house. I had a young man call me from Seattle right when it broke out there. His mother was at Stanford, fell, turned out to have, unfortunately, advanced lung cancer, tumors on her spine, which was the cause for the fall. And she was now end-of-life care. And so I've been on the phone with him almost every day for a month, and we got him here, we got him into Stanford, and we got them over to Mission Hospice, and It was very moving, but he thanked us for giving her a peaceful death. So there are ways to navigate every situation. If you are dealing with somebody, I'm talking to our viewers now, if you are dealing with somebody and they're in the hospital, to think about these discharge options. It doesn't have to be just one thing or the other, especially with the teams. I think everybody is very kind in healthcare, and everybody's really trying hard to be compassionate and work with unique situations. So.
There's a question as well about what is your opinion of the need for independent living facilities to prohibit visitors, family included? Unfortunately, I think until we have a broader testing strategy so that we know where pockets of infection are, it is quite high risk for anybody to go into an independent living facility to visit until we know more. I hope that will change soon, because it is hard, very hard for everybody to be so isolated. That's my opinion. I don't know if others have different opinions.
Okay.
And I wanted to add something else, that we need to change this again, just overall the impression about if a facility has a positive case, we should not blame that case, the facility, that, oh my God, they have a positive case, maybe they've done something wrong. Let me just say as an example, Dr. Mehrdad Ayati can be positive and asymptomatic and go to one of the facility and see one of my patients, and I can infect many of the people. Is it the facility did wrong? No, Dr. Mehrdad Ayati was positive and he was not aware of that he was positive. Or the same thing for Dr. Mark. I mean, this is not the situation that we should blame the facilities that because
Absolutely.
They've done something wrong. First of all, as we discussed, we haven't provided enough educations for them earlier. We're talking about years before, months before. Everybody know this is not about COVID. This is all about facilities, infrastructure. We haven't changed that. And then we haven't provided that. I mean, we have to really go to the government level and say, this is the time that we need to change the supervision. This is the time we need to change the level of education for facility, help them, support them, not blaming them. I mean, this is something that I'm always, when we do the survey in any facilities, we try to more focusing on blaming them. This is not blaming, is always saying that if we have any point, this is the opportunity to learn that what we have done from that mistake last year, and we're gonna change to the new opportunity. We have to understand if any memory care, any assisted living facility, they have positive, we cannot blame them. If that happens, the same thing can happen. Young people can be positive and it can be infected. We lost many nurses and the doctors in the hospitals in New York. Should we blame all the hospitals in New York that because there's something wrong that they lost many doctors and the nurses? No, this is the very violent infection. And I think we need to really change this picture. And this is exactly, even when I talk to media as well, I always try to tell them, this is not the time to blaming anyone. This is that time that we learn the lesson. Painful lesson, but it's very valuable.
One other question I don't think we answered was related to church groups or other social organizations that are ready and willing to help. And we have people who can sew out there. And I would say if anybody lives in a community, we have been trying to help get cloth masks to all the residents to wear if they are out of their apartments for any reason, for a walk or anything else. And that's now mandated in many places, San Mateo County, the city of Palo Alto, they're really, and others are starting to really enforce and push people to wear cloth masks. But it's actually quite, while we haven't tested it specifically for COVID, there are some interesting recent videos that were published in the New England Journal of Medicine of how many droplets are produced with regular speech, with the mask and without, and it's pretty dramatic. So even in just regular talking, we produce respiratory droplets that, if we're infected, can easily spread the disease. So wearing those masks to protect others, having staff in senior communities wear masks at all times is very critical. So that's those are a couple of areas where groups can help, I think. And gowns are the hardest thing that we've been able to, and Dr. Ayati said this too, to get to facilities. Actually, that's the biggest shortage is gowns. So for wonderful sewers out there, if you have extra fabric, washable gowns might be a helpful thing.
Okay, are there any final questions for either of the doctors? You can put it into chat now. And what Dr. Ayati put into chat was that if anyone has any protective equipment, that you can contact Paula Wolfson, and I will bring up her information in just a moment. Okay. It looks like we got all the questions answered. Thank you so much. And the more that we all learn, for better or worse, we're more informed, and it's scary, but it's good to know what's going on and what we can do. And I really appreciate you both saying, you know, changing the narrative or being mindful of the narrative that we have with these facilities, because they are just facing huge challenges right now. So what I'd like to do here is share my screen one more time. And I want to show you what is coming up next. So we have, as I mentioned, throughout the month of April, we have had these town hall presentations every Wednesday, and we actually have a 5th Wednesday of the month. So next week, which is amazingly already April 29th, at the same time, we will have Dr. Ayati back here, and he's going to continue to update us of what's happening and talk about, you know, looking maybe beyond this, or what's coming down in not just weeks, but months, and the possibility of a second wave. So he will be here again at the same time. And if you would like to register for that, please go to our website, and you can register through ActiveNet. And many of you I know at this point have Avenidas login. If you have any questions, just contact us. I have up here my contact information with my email address. If you have any questions or feedback, I'm happy to hear from you. And at the bottom of the screen here, I have the information for Paula Wolfson, who was on talking earlier. So she can help you and your families navigate these situations with a lengthier conversation and help connect you with resources. On our Avenidas website, under Avenidas Care Partners, there are other PowerPoints and information about patient rights, informed consent, filing a grievance in Medicare. As Paula mentioned, she has a lot of experience with the hospital and healthcare system. So that is up on our webpage, avenidas.org. And this will, as I mentioned, this is recorded. And so this will be up on our website just in the next few days here. So thank you again to both Dr. Martin and Dr. Ayati. We really appreciate it. And I appreciate all of you taking the time today to learn this information and help figure out what we can do next. Thank you so much. Have a good rest of your day. I hope to see you next week.
Thank you.
Thank you.